I'm your Jesus-loving and potty host, L.A. Sprague. Welcome to Christians with Chronic Illnesses. I'm super excited because today I get to interview Emily Hermann. So, Emily, you live in Chicago. Yes? Chicagoland.
The deep suburbs, but I say Chicago.
Okay, classic. Well, why don't you just tell me and tell everyone listening a little bit about yourself?
So my name is Emily. In December of 2023, during my 28th week of pregnancy, I was diagnosed with B-cell ALL, which is a type of very aggressive leukemia. Since then, it has kind of fueled a fire in my heart to serve the cancer community any way that I can and grow spiritually with the Lord and how I raise my family.
Yeah. Wow. I can't imagine it being in pregnancy, like figuring that out. That must have been, what was that like?
It's definitely something you never think is going to happen. Not even like one of those things where you don't think it's going to happen to you. I didn't know it was really even possible, but I just really knew that I had to really rely on the Lord at that time and just trust in the peace that He was giving me through it all. So,
Yeah. Well, I can't wait to hear more about that. So why don't you tell us a bit about what are you passionate about? What do you like to do on a day-to-day? You said you're focused kind of on raising your family. Do you want to share a bit about your family or what your life is like on a day-to-day?
Sure, yeah. I have one really rambunctious toddler. He is 19 months old now. We're in that toddler phase where I'm like, yeah, I kind of miss the newborn phase. So we saved up for our place. It's pretty much a dream. We have our garden and we just love it here and everything that we've always wanted.
Aw, that's cool. You guys garden?
Oh, yeah. Oh, yeah.
Aw, like foods and stuff, like vegetables and oh my gosh, what do you guys have right now?
So right now, pretty much all of our vegetables are dying off for the season, which is okay. I mean, we were harvesting 10 pounds of cucumbers every other day. But
Wow.
right now we have strawberries and gourds and a few cantaloupe.
Wow. I'll have to take some notes from you because me and my fiance have talked about gardening a lot, but I'm it's on my to-do list, or my, not to-do list, but my goals list of this year of being 25 years old. One of them is to grow at least, I think I said 3 edible plants, whether it's peppermint or basil or whatever, strawberries. And I had peppermint and basil, and the basil died within days, and and then the peppermint is okay. So yeah, I'm much better with succulents.
You see, that's the opposite of me. I can't do succulents, but it is just
Really?
so fulfilling.
Oh, that's really cool. So you said that you had told me during our pre-interview you also love serving, you said, cancer patients, right, in creative ways. So what are some things that you do to serve the cancer community?
So I do a lot of designs and a lot of creative videos to raise awareness for leukemia. Because like I said, I thought it would never happen to me. I had no idea anything about it. And I feel like everyone assumes it's a pediatric cancer. So it's really important to me to raise awareness for young adults our age. Yeah, it could happen. Here are the signs. So I love making, designs on Instagram, even t-shirts.
Like graphic design kind of stuff.
Mm-hmm.
Oh,
Yeah.
did you make the one you're wearing?
Yes, I did.
I was literally gonna compliment that.
This was inspired. I saw another shirt template that had something very similar, so I kind of threw my own spin on it for my personal merch.
Wow. I love it. That's so cute.
Thank you.
Yeah. What was you said pediatric cancer? What's pediatric? What's that mean?
So diagnosed in children.
Oh, okay.
Yeah.
Gotcha. Okay, so why don't you tell us now, like, a little bit about your faith? Like your shirt says faith over fear, right? So
Yeah.
what does that mean for you? Like you're Christian and
Mhm.
I want to know, I don't know, like what is that like every day for you? Who is Jesus to you?
So I grew up in a Christian home, but I feel like I personally made that connection with God when, like, I think it was the day before my 13th birthday, where like it really like made sense. Like, oh, this isn't just something I grew up believing. Like, I actually truly trust and believe this.
Hmm.
So that's kind of like the foundation of my testimony. But especially now with my diagnosis, I mean, I understand this is completely out of my control. Like, I can't control any aspect of my health at all, or my treatment, or how I respond to treatment. So when my anxiety does arise around the issue, I just spend my time singing, praying, and when I can't, I draw song lyrics and pictures to go around it. So I feel like that is kind of the foundation of how I'm holding it together. Because as a mom with, a fatal illness, it's day-to-day life is extremely terrifying. But really relying on the Lord in those times of anxiety is, like I said, how I get through it.
Yeah. Yeah. So did something happen at 13 that like you said like the day before you turned 13 was there something that happened or just around that time you're like, yeah,
At
this
church camp.
oh, cute. No way. That's adorable.
Yeah.
What camp was it?
Silver Birch Ranch. I volunteered there a little bit too when I was an older teenager, young adult. So that place is dear to my heart.
Oh, what was like the thing that you feel like, I don't know, was there like a sermon or something or an experience that really kind of pushed you
Yeah,
that way?
I remember the pastor's name, Pastor Dewey. I can't remember what
Hmm.
church he's from off the top of my head. This was like a million years ago. But I felt like he was talking directly to me, and that's the first time I ever felt that. And I was just like, I feel like this is God talking directly to me. I feel seen. Like,
Oh.
this is like a one-on-one moment between me and God right now, like through the words he was preaching about, just growing up and taking like those leaps in faith and making it your own. And I was like, oh, you're right.
Yeah.
Yeah.
Oh. Yeah, that's cool that you say that you felt seen because even in our previous discussion, you emphasized that for people listening, you want them to feel seen by us, by, chronically ill Christians, by terminally ill Christians. You want them to feel seen by God as well. And so that seems to be like something that's kind of tracked with you if, at around that age, 13 or so, like you felt really seen by God. I think it's really pure that now years later you're like, okay, that feeling that I felt, like the eyes of God were looking into yours, like you want to share that with other people, and that's just really sweet.
Absolutely. And I've been trying to find a way to do that, even like before my diagnosis. Like, how
Mm,
can I best like be a light to others through what I've been through?
mm.
And God said, guess what? I'll give you a way on how you can relate to people. And, very selfishly, I prayed when I was diagnosed. Like, I'm not worthy at all to ask this, but I said, God, if you're going to put me through this, please let me be here to see something come out of it. I don't get
Yeah.
to ask that of God, but it was just on my heart. And, having that moment with Him,
Mm.
sharing my feelings was also very important, because I feel like now no prayer is too embarrassing
Oh, yeah.
or, too deep in the moment to bring to God.
Yeah, good, because it's not.
Yes.
Yeah, it's absolutely not. Okay, so you said that you were diagnosed with leukemia, right? Is
Mhm.
that your main condition? Do you have other conditions as well? How did you know things were beginning?
Yeah, so I also have POTS, and I was also starting to dig into diagnosis for EDS,
Mm.
because Ehlers-Danlos syndrome, because I do have a few symptoms of hypermobile EDS and kept getting referral after referral. So I wanted to know if that was something that I could pass on to my baby.
Mm.
So I began those tests, and that's when those tests were the ones that revealed, like, hey, something bigger is going on
Oh, wow.
with your cells and everything like that. So,
Yeah.
and then even with the POTS, I have been dealing with that, I want to say almost like my whole entire life, especially with SVT.
Oh, what's
That
that?
it's, I'm trying to figure out how to explain it. It's when you do something to raise your heart rate, like 0 to 100, basically. Okay, like 200. So like for me, like just bending over and like picking something off of the floor, I'll stand up and suddenly my heart is
Mhm.
clocking at 200 beats a minute.
Mhm.
And then they're called like vasovagal maneuvers.
Mhm.
So it's basically like a stretch to kind of like reset everything that's going on, bringing my heart rate back down. So I learned how to do that from an early age. And then in high school was diagnosed with POTS.
Mhm.
And I began feeling like really dizzy and weak. And I kept trying to like tell myself, like, well, Emily, you have POTS. Of course, this is going to happen. But I'm like, no, I've had POTS for years.
Mhm.
I'm
Yeah.
used to this. This is something completely
Mhm.
different. It's not based on what I'm doing at the time, to
Mhm.
raise my heart rate.
Mhm.
It's just happening out of
Yeah.
nowhere.
Yeah.
Well, that was like my key sign, like, okay, I gotta go into the ER to get this checked out.
Yeah. Wow. Okay, so I'm curious to hear in your childhood, like, did you always feel symptoms of POTS? And also, could you explain a little bit what is POTS and what were the symptoms? How did that affect your life? And then maybe we can, talk about EDS and leukemia as you know, so those to start to develop. But do you mind like going, kind of back to the beginning and talking about like your childhood?
Yeah, so definitely with the SVT, like I said, like I would just bend over and stand back up, and my heart,
Mm.
like you could see it jumping out of my chest, like it's something you can
Wow.
physically see. So, I begun explaining that to my pediatricians during my yearly checkups, and they're like, when that happens, try bringing your knees to your chest and see, like, lay on your back, bring your knees to your chest, see if
Mm.
that gets rid of it. Sure enough, it did. Then they later explained the big terms and the big words, and I'm like, okay,
Hmm.
So I was pretty calm about that until I got to high school. I passed out a few times at school.
Oh
I
no.
also have what's called post-micturition syncope, which is basically, or syncope. I know people pronounce that differently. I've been hearing different pronunciation. Like, okay,
Right.
what's the right one? Basically, I relax too hard when I use the bathroom. I'll go to stand up too quick and
Oh
all
yeah.
over. So it's specifically
Mm.
bathroom induced. So that was really embarrassing going through that in high school.
Oh, I
Then
bet.
my mom was like, okay, this has been happening way too often. I'm getting too many calls from the nurse. Let's take you in. And I actually passed out in front of the doctor that was examining me.
Oh my
And she's like,
goodness.
okay. She's like, I know what's going on because I have it too.
Oh wow, your nurse had
You have
POTS.
you have thoughts. So
Oh my
um
goodness.
did my testing. Sure enough, they're like, whoa, okay.
Mm.
Like,
So what is POTS and what was the testing for it?
so POTS is postural orthostatic tachycardia syndrome. So depending on your posture, that can raise your heart rate, drop your blood pressure, make you dizzy, pass out, or dizzy enough to be nauseous. Sometimes it can kind of feel like vertigo, but not necessarily. I've had both, not necessarily the same. And the testing for it, well, besides passing out in front of your doctor, that's one way to do it.
Right.
EKGs, I had to do a heart ultrasound and tip table
Mm.
test. But I didn't have to do the tip table test because I
You
was able to
passed
pass
out
out
in
in
front of
front of
your
them.
doctor,
Yeah, so they're
right?
like, we're not gonna put you
Through that
through
torture.
that. Like,
Yeah.
you're good.
Yeah.
Yeah.
Well, that was
And
gracious of them.
cardiologists, in addition to that, were like, yeah, we're confident.
Yeah.
After seeing it, like,
Mm.
We're not going to put you through it.
Yeah, good. So you got a diagnosis pretty quickly in high school then?
Yes.
Wow.
And I
Okay.
know that's not typical for people.
Right.
So I feel very blessed that,
Yeah.
you know, on top of everything else, that was able to,
Yeah, I get a pretty
happen.
quick diagnosis. So were you able to make it through high school okay with that?
Yeah, I missed a lot of school. I almost had to get transferred to the alternative school, but my grades
Mm.
were still good enough. It was just my attendance that was kind of,
Yeah.
yeah.
Wait, so the alternative school, is that like a kind of a disciplinary school? Or
Yes and no. There's two that are connected. One for like if you just miss too much school based on whatever reason, to help get you caught up. And then there's the disciplinary
okay,
side.
okay, good. Okay. I was gonna say that
Yeah.
would suck if you got like disciplined for missing school because of your health.
I would be like, oh no, get me out of here, please. No.
No, no shade to anyone listening who had disciplinary
No.
issues, you know.
Hey,
We get it.
everyone from my friend group in high school got sent there, so I was kind of like,
That's
send
so
me, please. I want to be with my friends, actually.
That's funny. Oh my gosh. That's really funny.
So
Okay.
that's why I joke about it.
Right. That's cute. So you had POTS. You got through high school okay-ish. You missed a lot of
Mhm.
school, and
Yeah.
so your grades, they were all right. Like they kind of made it through. Okay, that's great.
Mhm.
I know that like that can be a struggle. Once I started like developing POTS in college, things really started to go downhill a bit. But anyway, I think there are alternative reasons for that, COVID and all of that good stuff.
That's how I didn't, yeah. That's what
Yeah.
happened to me.
Yeah. So you had POTS, and then how long have you been feeling like EDS symptoms?
My whole life, like I would be able to do these weird things with my bones. I would be constantly like getting injured as,
Mm.
I got older and these injuries took longer and longer to heal. And I'm like, no one else is like this around me. Like, how am I able to, pull my arms back up and around? I'm not allowed to do that anymore, by the way, doctor's orders, but pull them around my head as a party trick. I'm like, why can't everyone do this? And same with my skin.
Mm.
My skin is a whole, I'm not going to show that on camera what my skin can do. But um, after seeing some like advocates talk about it on social media, I'm like, there's a name to, all my
Oh.
symptoms.
Mhm.
And just the fact that so many people with POTS have hypermobile
Yeah.
EDS and EDS too. It's kind of putting two and two together. I'm like, maybe I should, bring this up.
Mm.
And my chiropractors, my orthopedist, I'm trying to find the term. Um, yeah, people who were checking out on my bones after my
Yeah.
injuries, people in the ER after all this, they were
Mm.
saying, "Have you ever heard of hypermobile EDS?" And I was like, "Yes." And they're like, "I think you should go get checked out." And same with my OB team. They're like, "You should go get this checked out before,
Really? Okay.
you go to push." And we're like, what are you doing with your
Yeah.
bones?
Oh.
So they really pushed me to like, yeah, maybe you should because it could also
Yeah.
be genetic. You can pass it down and you're going to want to know
Yeah.
if your baby has it just for, injuries and just to be aware. So I'm like, you're right. If
Yeah.
it's not enough for me, definitely affecting my child. Yeah, that pushed
Yeah,
me to.
absolutely. Yeah. So what is like the testing for that?
So it's basically a blood panel because there is a type of EDS that can show up in your genes.
Hmm.
So I was already doing the Natera test for pregnancy that shows if there's any genetic issues that could affect your pregnancy.
Oh wow.
And I figured, okay, I can do that. And if that shows up in there, I'm not going to really pursue any other blood tests or anything because I passed like the physical exam for it.
Hmm.
But there's also specific specialists you have to go to. And I'm like, I'm not gonna spend the money to go to these specialists and to seek out these really hard to find specialists if,
Mm.
my test comes up fine, and it didn't. And I ended up having to see a genetic counselor, and she was like, yeah, we couldn't even read your Natera test because of basically leukemia cells with this chromosome that was copied. I'm trying find the best way to explain it.
Yeah.
Like, this copy keeps showing up. We can't read your other cells or
Wow.
genes or any of that. And she's like, some people just have these. You could just be one of those people. She's like, rarely does it ever turn into leukemia. And I'm like, what? She's like, yeah, if you had leukemia, you'd be like bleeding out of your eyes, ears, and nose by now, and
Oh,
having all these other symptoms, but you seem fine to me.
classic.
So I'm like, okay, I'm not going to pursue any more EDS testing. Like, I got my answer. Yeah.
So how and when did you get your official leukemia diagnosis?
So I got that test done in September, and in December I was diagnosed. That's when I started showing symptoms, and then having, I passed out after getting out of the shower, and I had a fever at that time, and I'm like, this is just too much. I contacted my doctor. She's like, go into the emergency OB, get this checked out, make sure baby's heart rate is fine.
Yeah.
She's like, you probably have the flu, but we just want to make sure, then a routine CBC later. And they're like, you're very sick, you're staying. We're going to figure out what's going on.
Yeah. So what were the symptoms that you were experiencing? You said you had like fever. You had a
Yes.
fever and you passed out. What are some of the other symptoms that you experience with leukemia?
Extreme fatigue to the point where I could only walk a few steps and I'd have to sit down and take a break and then go back to whatever activity I was doing, take a break. On top of that, I had this horrible, horrible pain in my hip to the point I thought it was cramps at first, or maybe the baby's sitting on a nerve or something, but I would be like screaming through these cramps. And I'm like, am I going into labor? Like, what's going on?
Right.
Why am I in this
so
much pain?
scary.
Turns out I was feeling my bone marrow dry up.
What?
I didn't know you could feel that. That's, their estimate as to what has been going on. It's a very rare symptom, typically, if leukemia has progressed week after week. I mean, it really only takes 2 or 3 weeks for you to show symptoms after your leukemia cells are activated or whatever.
Wow.
So that's why they call it acute, because it happens like that. So yeah, by whatever point, however long I had it, my bone marrow had dried up, and that's what I was feeling. Extremely painful. I had like a few scratches and bruises and like everyday scratches and stuff like that, hitting the furniture, with my elbow or something. Or, cats and stuff like that. And my blood would just not clot. And when it did, it was like really like, sorry if this sounds gross. It was like really
it's okay.
goopy. It wasn't like drying. It was like I'm like, something's off.
Yeah.
I'm like, why? My mind kept going back to leukemia. Leukemia. This doctor mentioned leukemia. I'm like, no.
Oh.
No. And I'm trying to think, I was extremely pale. I had a little bit of jaundice. Like, my lips had no color in them whatsoever. They were the same color as my face. I could see my veins that I've never seen before. Once again, I'm like, well, I'm really putting on the weight with pregnancy. Maybe it's just, I'm not used to seeing my body like this, and this is normal for everyone going through, weight changes and skin changes and stretch marks and stuff like that. No, found out that wasn't normal. So those were my symptoms.
Wow. And how are your symptoms now? Are they still similar? Are they different?
My blood counts have recovered. I responded well to treatment.
That's awesome.
Technically in remission. We have another term for it. It's NED, so no evidence of disease.
Oh, that's incredible. Oh my gosh.
I still have to finish out treatment. You have to finish your antibiotic, even if you're feeling better, just because it has an extremely high relapse rate. The older you are, the more at risk you are. So I do have to finish treatment. But yeah, I'm my blood counts are consistently staying on the low side, but still healthy to where I don't need
Right.
transfusions anymore or
Oh
anything.
my goodness. So what were transfusions like? Thank you so much for spending your precious time with Christians with chronic illnesses. Your support means more to us than we can even describe. If you have a desire to donate or join a subscription for Christians with chronic illnesses, please see links in the show notes below.
I learned to know my symptoms when I needed one,
Okay.
and I would start feeling better, but it would only last for so long. Like I would be in the office maybe 2 or 3 times a week getting blood or platelets.
Mm.
I mean, I had to visit the ER even because of issues healing after having my son.
Mm.
That was extremely scary. And every single time, I'm reminded of the hemorrhaging woman story
Oh.
in the Bible. And I'd pray in my head, like, God, this is me reaching out to you. I know you can heal me. I can't decide when my body can start making blood again
Yeah.
and platelets and regenerating. The doctors can't help with that. They can just give me transfusions. There's nothing anyone can do
Mm.
to make my body snap back in order. Only God can.
Yeah, right.
So I really leaned into him, praying in the seat, with
Mm.
my infusions going like, God, this is
Yeah.
me reaching out. I know you're
Oh.
the only one. You are the only one that can control this.
Yeah. Do you feel like he answered that, or what do you think?
Time and time again. And
Really?
even if it wasn't on my timing, he gave me the peace in the moment.
Wow. Wow. That's so beautiful, Emily. So what were the transfusions like? Like is there like a machine or is there like IVs? What's that? What is it?
Yeah. So it's like if you've ever had to get fluids, same exact thing. They just
Okay.
hang up a bag for packed red blood cells. It has to be specifically matched to your blood type. There's so many factors that go into it. They cross match you to make sure or to like at least limit the risk of an allergic reaction
Mm.
to it. Thankfully, I've never had an allergic reaction
Yay.
to but yeah. Platelets are a little bit more easy to deal with. You don't need an exact match or whatever.
Yeah.
You can have an IV like in your arm or, a PICC line. For me, I had a port surgically
Mm.
placed. So I numb it up with the cream, can't feel a thing. They stick a needle through that, and that's how they do it.
Wow. Okay. What's a port? Like, does it connect to like some sort of blood vessels or something?
Yeah, I can show it. It's not
Okay.
like gross.
Yeah, you're fine.
Let me try to find it. Here it is. So it's just like this little bump under
Okay.
my skin. That's the port. And then here is like the tube that goes into my artery.
Okay.
And so they like put
Huh.
the needle in the middle of that. And then,
Okay.
yeah.
And they know like just exactly where it goes and everything.
Mhm.
Wow. Okay. So that will that be there the rest of your life?
No, as soon as I'm done with treatment and after my last biopsy shows I'm completely,
Mm.
clear, I can have it removed.
Wow. You're
I
nervous?
kind of want it. I kind of want it the
Oh.
rest of my life, just in case I get dehydrated or something. Like, yeah, just use my port. Don't stick my arm, please.
Stop.
Or if I have another baby or anything, if I'm blessed to have another child, like, yeah, I'm just right here. Like, don't stick me in my arms. I'm tired of that. So convenient.
That's so funny. Like, yeah, you guys could just leave it actually. Like,
Yeah, I'm good. I like it. Everyone should have one.
that's so funny. I'm glad it's convenient for you.
Very.
Wow. Okay, so you said that at times it was kind of scary, right? So what do
Yeah.
you think was like yeah, what do you think was the scariest instance? And was there also, well, okay, that's one question. What do you think was the scariest instance? But I'm also curious, were there any moments that your chronic illnesses decided to like make a hurricane of a storm for you? So I don't know, you can
Ugh.
pick and choose those if you want.
Yeah, so definitely when I was having issues healing after having my child. I'm like, I'm gonna have to get rushed into emergency surgery. Am I going to completely lose the ability to have children in the future because of this? Am I going to bleed out?
Mm. Wow.
Thankfully, that wasn't the case. And definitely through what we call neutropenic fever. So I have no red blood cells, no platelets. I also have no white blood cells, which fight infection. So I can get sick, and that can lead to sepsis
Mm.
extremely, extremely quick.
Wow.
Um, like no immune system at all. Like I have no defense or had no defense
Mm.
against illnesses. Now I have a little bit of a defense.
Oh, good.
So that was scary. I went through bacterial meningitis, sepsis. Ugh.
Mm.
And the only like real whirlwind hurricane that my other conditions have caused, it's just like trying to figure out, is this a chemo side effect or is this pre-existing? And they can kind of mimic each other and just kind of like
Mm.
combine and double what's going on to where it's hard to figure
Wow.
out.
Yeah.
Because if it's something, like POTS or like another condition I've had my whole life, we're like, okay, there's no immediate way to fix this, but it's not life-threatening as compared to a bad chemo reaction that is life-threatening and needs to be dealt
Mm.
with immediately.
Hmm.
So it's always a struggle to figure out which one's which.
Yeah. So what were like the similar like symptoms that you were trying to decipher?
Blood pressure changes, migraines, fatigue, dizziness, even with like symptoms of allergic reactions
Mm.
and inflammation. They're like, maybe we should try looking towards like something like rheumatoid arthritis. I knew that was a possibility at one time that they were
Mm.
looking into. And
Mm-hmm.
that happened to be a reaction to chemo called ICANS. So that's kind of like inflammation, neurological symptoms, and like nervous system
Okay.
type issues. I think that's how I can explain it the best.
Mm.
So I was hospitalized for that and whatever. And, that's something you have to solve right away. And we're thinking it's something else that
Mm.
can be easily managed, not easily managed, you know what I mean, but can be managed at home and, just waiting to pass over, doing what we can to make it comfortable until those symptoms pass over. But it was
Yeah.
something, yeah,
Yeah.
that went on.
So did you have to like just keep communicating with the doctor when you were having symptoms, even if you were like, I don't know if this is this or okay.
Yes.
Wow.
And I live 2 hours away, so normally that's done over a phone call. And sometimes they're
Um,
like, come in to the ER or come in so we can see you. And sometimes they're like, you know what, it sounds like this. If it doesn't go away in 15 minutes,
oh
call me
wow.
back. Or with a Tylenol, call me back.
Wow. Okay. So you had chemo, is right.
Mhm.
So what do you know what is chemo and how it works, or what was the process of chemotherapy?
So there's a few different types of chemo. The first type is IV chemo. So like through an IV, I was admitted for my first rounds. That's typically when people lose their hair, is like the heavier IV chemos
Mm.
inpatient. And that's when, blood levels can dip and everything and transfusions are needed. And that's kind of like the hardest to get through
Mm.
mentally and side effect wise. And you're
Yeah.
also like seeing yourself change before your eyes. Like, I didn't know what I looked like without eyelashes and eyebrows and,
Mm. Yeah.
not having my skin color and everything like that. And then there's also intrathecal chemo, which if you think of an epidural, it's kind of like the same method. They go in through your spine into your cerebral spinal fluid or your spinal fluid
Mm.
and inject chemo that way. And then it coats your brain fluid from leukemia
Wow.
seeping into your brain fluid. That's my least favorite. I think it's
Oh.
borderline inhumane and I hate it.
Oh.
That's been the worst part. There's zero side effects to it. It's just the process.
Yeah.
Oh, just no matter how much they numbed me, I still always felt it. I really didn't
Oh.
like it.
Wow.
And then there's oral chemo. You take a pill, you get some heartburn, a little bit of nausea, and then you're good till your next dose. It's
Wow.
not as hard for me personally. I know it's hard for a lot of other people, but for me personally, it's the
Yeah.
IV chemo that stinks.
Yeah. Mm. So did they like have you throughout like all three of those consistently? Or was it like a process like you do the IV at one point, you do the epidural type another, and then the pills another?
Kind of, yeah. So induction is your heaviest IV chemos. So that's when I lost my hair. That was like,
Mm.
you're supposed to kind of complete it within 4 months. I had so many complications with it. I think it spanned it over more towards 6.
Wow.
And then after induction is consolidation. And for me, that was strictly immunotherapy, which is kind of the same method as IV chemo. It's just a different type, like it targets different cells. And now I'm in maintenance, which is a combination of IV chemo, not as heavy anymore as induction, obviously. I have my hair, it's just thinning,
Mm.
and immunotherapy and oral chemo. And all throughout this, the intrathecal as well. However, I haven't had intrathecal. They're giving me a break from it just because of how traumatizing it was for me.
Oh, sorry to
They're
hear
like,
that.
They're like, you've made it to maintenance. We can kind of space it out now for you
Yeah.
to give you that mental break.
Yeah. That's
Because
good.
I was basically like telling them, I'm not coming in no more for this. I hate this.
Oh, I can't blame
But they're
you.
like, you gotta do it. I'm like, okay.
Oh, well, I'm glad that your doctors are giving you like a break from the one that honestly, yeah, the process you described does sound very like uncomfortable to say the least, degrading
And
almost. So, oh,
I have a high pain tolerance. I always have, dealing with a lot of injuries as a kid. I have tattoos all over, everywhere you can think of. But it's not until you're like consistently in an extreme amount of pain almost every single day to the point where you're
mm,
like, even like the littlest bit of pain, I'm like, no, can't do it. Can't
oh,
do it.
yeah, yeah. So, what, like, I know you tried explaining it a little bit earlier. Like, what is leukemia? Like, obviously it's cancer, but do you know like how it works?
Yeah, so I can really only speak for B cell ALL. It starts in your bone marrow. That's kind of like the main difference between leukemia and lymphoma. So B cell ALL starts in your bone marrow. And basically, this type of white blood cell just grows wrong. Not only wrong, but starts taking up space for your other cells to grow, like
Mm,
red blood cells, hemoglobin specifically, which carries oxygen to the rest of your body, into your organs and your tissue, and platelets, which help your blood to clot, and other white blood cells to fight off different types of
mm,
infections. So I that's why I couldn't really clot. That's why I was feeling so fatigued because I wasn't getting the oxygen to
yeah,
my tissue and to my other organs, and why I had the fever because I was sick. I had no defense really against getting sick. So
yeah,
that's where the symptoms come from. It's
right,
because I didn't have any of those cells, and
yeah.
it attacked my bone marrow so much. Like I said, it completely dried up. And then, yeah, that goes from your bone marrow. Bone marrow connects to your bloodstream through blood vessels. I think someone explained it to me one time because I'm like, wait, hold up. How do the cells get from your bone marrow to like your
Yeah,
veins?
yeah,
So I'm sure, someone else has a better
right.
explanation than I could ever put into
Oh,
words.
no, that's okay. Okay, so
So yeah.
I'm very happy to hear that you're basically in remission right now. That's awesome. And I really pray that though it has a high, like you said, rate of what was it, relapse? Is that what you said?
Mhm.
I pray that the Lord will keep you like stable at least for a while, if not
Thank
permanently.
you. Yes.
Yeah. So how's that been like trying to deal with like the reality of genetic, right? Like genetics and having a child. is there like a connection that gives a higher risk to your child for leukemia and POTS and EDS if you have it? Is that a risk? And has that been like, yeah, I don't know, just like, is it scary as a mom? What's that like?
It is extremely terrifying. I feel guilty in a way because I didn't know a lot of this, when we were, talking about kids, but I have to remember like the chances of that are so slim. Like it's not my fault, first of all.
Yeah.
You know, I thankfully know the signs. If anything were to happen, I know what to do. My husband knows what to do.
Yeah.
I feel like we can handle anything that comes up along those lines. But doctors have been reassuring me that there's such like a slim chance of that happening. I mean, like I said, I couldn't complete the testing for genetic EDS because we couldn't really see those cells, I guess, that show it. I don't even know if cells are the right word. I'm trying my best.
It's okay.
And so far with leukemia, it does run in my family, but the last person to have it was my great grandma. So it
Oh,
seems
wow.
to only be affecting the women
Okay.
from like my grandma's side
Yeah.
on down.
Yeah.
So I don't know how
And
true it is to be able to say it skips two
right.
generations or
Yeah.
not, or,
Might just be like an underlying thing, which would be great, affects less people. But even if, like, I hope this doesn't sound shallow, but you would say, I think, well, I'll ask you, would you say that life is worth living even having gone through leukemia?
absolutely. Definitely very challenging. I've had to
Mm,
try to adapt my life and living my 20s, differently
yeah.
than what I planned and also differently than everybody else. But
Mm,
I've found like, I don't want to say like my purpose, but I've found a lot I can still do
mm,
to serve others because ultimately that's my goal
yeah.
on earth. That's what the Lord has placed in my heart. I
Mm,
can still do that. That doesn't have to stop. My life doesn't have to stop
yeah.
because
Wow.
of what
Yep.
I'm going through. I just do it differently.
Yeah. Yeah. That's a beautiful perspective. That shows a lot of resilience, honestly.
Thank you.
Yeah, it does. And I hope that gives you hope too, Emily, to know that even if, like, God forbid, your child does develop something like that in the future, you gave them the gift of life and you didn't intend any harm for them. And even if, again, God forbid, something did happen or develop, that the struggle was worth it, and so I hope it doesn't happen. But if it does, like, I just hope that you're able to remember, like, okay, but there was hell, but there was hope, there was
Yeah.
life. And so I hope that that's somewhat encouraging to you to remember, like, but I wouldn't, I'm still living, I'm still, pursuing life. So I hope that's encouraging to you. And that I think your kid will have that perspective as well.
And treatment is progressing so much for children. Like
Mm.
for children right now, I think it has like a 95% success rate. It's just
Wow.
past, I think 17 or 18 is when, you know,
Mm.
it starts decreasing.
Okay.
So I'm, praying. That's definitely in my prayers, like, God, like, please, with, the research that they were doing and
Mm.
even some of these new things that I have been, like, new types of treatment, like they have been trying at my office, like, please, like, let this
Mm.
progress so much
Yeah.
that who knows, like, there will be like, it's just like one infusion you have to get if you're ever diagnosed, and then boom, you're done.
Yeah.
No side effects. I definitely pray for
Mm.
treatments to come out that have no side effects, and
Yeah. Oh. So do you see like a future of like serving the cancer community? Yeah. Okay. That's awesome.
yeah,
Oh, how do you
I
intend to do
love it.
that? Is there any,
Um,
like, I don't know, any way you'd like to connect with anybody who's listening who might have cancer? Is there any resources you'd like to provide or talk about?
Absolutely. So I would say if someone is listening who needs specific resources, definitely reach out to me either on Instagram or TikTok or YouTube. I make like a lot of life hack videos, like
Hmm.
here's some easier ways to kind of adapt to what's going on. But also there's a lot of charities and organizations I could connect you to that I use myself financially for, like a creative outlet to get active if you're someone who wants to stay active during your diagnosis. I definitely am. I
Yeah.
use, all of those. I can get you connected. I'd love to.
Hmm. What's your favorite? Like, what's an
Um,
organization that really helped you,
um,
or a group that really helped you to get through it?
I would say I'm gonna have to bring up two. Definitely one for kind of like the mental health
Hmm.
portion, Immerman Angels. They provide free one-on-one support. They connect you with a mentor with the same or similar diagnosis and treatment plan. So I was connected with another woman who had B-cell ALL while she was pregnant as well.
Wow.
And she also has young children at home. So I was able to, ask her, how do you, tackle motherhood? Like, is it possible?
Aw.
And she's like, you'll figure it out. Yes, it's possible. Like, don't lose hope. My son is up
Aw.
from his nap now. I hear him.
Oh,
But
cute.
his grandpa's here just in case. And so that's good. I'm a mentor now. I signed up to do that because I'm like,
That's awesome,
you know,
Emily.
that
That's
proves I'm not the only person going through this.
yeah. And could you say the name of
So,
it one more time?
Immerman Angels.
Immerment Angels.
Immerman. Imerman Angels.
Oh, so
And
cool.
then as far as like a creative outlet, there's Tough Friends Art Club. And they meet pretty much every month and they send you art supplies for free. And then you get on a Zoom call and then you all do the art project together.
That's
I
so
love that group.
cute. What? That's so
And the
sweet.
and then there's a play it back music program where you can record music that you've written. So
Oh,
there is
wow.
so much out there that I didn't even know when I was diagnosed.
Yeah, that's really neat. I love that. Cool
Great, great
resources.
people.
So I wanted to ask more about your experience with you had mentioned that sometimes when you were getting your infusions, you would remember the woman that was like profusely bleeding in scripture. I wondered, could you talk about maybe that story a little bit for those listening who don't know it, or maybe you're familiar but forgotten the details? And then, like, why did that story touch you specifically in those moments?
Right. So back in, I'm gonna try my best to
Yeah.
find the right words. Back, I feel like in that time, women who were hemorrhaging were seen as unclean and unworthy. So it was hard to find support, to find help.
Mm.
And at first, she was full of shame and her faith in God, surpassed her shame. She reached out just to touch Jesus's cloak. And she knew that if she would touch him, she would be healed, and her faith alone saved her. So, kind of how I pray when I'm going through it during that time where I'm feeling like my life feels like it's over. I feel like no one can relate to me. This is awful. I'm having a rough time. And also, like, I don't have control over this situation. I'm like, God, this is me reaching out to you and reaching out to your cloak because I know you're in control and you're the only one,
Mm.
who can take this
Mm.
and change it.
Yeah. Yeah. Was there ever like, you said in those moments you kind of just felt peace?
Hmm. Just
Mm.
the peace that surpasses all understanding. Like, I have struggled with insomnia my entire life, and definitely with this, staying up like, what if this happens? What if that happens?
Right.
And I'm like, God, just fill me with that peace. Like, I can't calm down. And before I'm even done
Mm.
praying, I fall asleep. That's completely
Aw.
unheard of for me. I can't just fall asleep like that.
Mm.
But, there's just been times where like I can't stop thinking. And yeah, he just fills me with that peace. And
Yeah.
it's just crazy to think. what peace can do.
Yeah. So, in what other ways do you feel like your illness and your relationship with God related? Were there any other, like, I don't know, were there consistent truths that you felt like you clung to or that he spoke to you, or were there interactions with the church that were helpful or not helpful? Like, yeah, how did your faith impact your illness, or how did your illness impact your faith? Where are you at now with your relationship with God?
It definitely grew it because I feel like before, you pray and you pray before you eat your food, you pray at the end of the day. I mean that you read your Bible at church. That's when you connect with God. But with this, I feel like it's a constant conversation between me and God now throughout my entire day. I'm just
Oh.
always talking to him. And definitely when I was diagnosed and I couldn't find any other words to pray other than, please heal me, please let me and my baby live. I would just turn on hymns and I would just sing in my room. And like I said, if I lost strength to sing, then I would draw the lyrics and I'd hang them up all over my room. And when I didn't have the strength to draw, I could read them. So
Wow.
when I couldn't, find the words with worrying, I turned it into worship. And that's what I did consistently
Mm.
and still do.
Oh, so praise music really helped you get through it.
Absolutely. Like the song, I'll praise you in the storm.
Mm.
Then I'll lift my hands because you are who you are, no matter where I am. And every tear I've cried, you hold in your hands. You've never left my side. And especially, like, I feel like that song
Mm.
hits home to like what I'm going through.
Yeah, Casting Crowns, man, they got some bangers.
Yes. I was
They
gonna
got some
say,
good
I'm
ones.
like, is there Casting Crowns or Mercy Me? I'm not gonna get it
I think
wrong.
Casting Crowns. I hope so. Sorry, Mercy
Yes.
Me, if that was you. Oh, yeah, that's a great song. Oh, that's
Yes.
really cool. So I'm wondering, did you have any support from Christians or from the church?
Absolutely. I think maybe after 4 or 5 days of being admitted, I got a ton of cards,
Oh,
um,
great.
gifted and like handwritten from other young adults and members of my church. They stayed after the service to pray for me.
Oh.
And I even got to like be on FaceTime while that was happening. And yeah, I got all these handwritten cards that, I mean, were filled out. I'm going to start crying like front to back with just prayers and just verses and just how much people love me. And
Oh.
it was just, I had a whole entire wall in my room just covered with
Mm.
just, really felt the members of my church and their arms around me.
Oh.
And it didn't stop there, Then the next week I get cards even from the same people saying, I'm still praying for you. You're still in my thoughts. Like you haven't left. This isn't a one-time thing. Like we're thinking about you. You're in our hearts. And Baby Ray, everyone called him Baby Ray, sweet Baby Ray.
Oh.
So
Mm.
yeah, he really
Mm.
had my arms around me from my church. And
Oh,
yeah,
dang. Thank God for that. That's incredible. That's so precious. What do you think was like, do you think there was any particular thing that someone said that was like really helpful, or was it just the continuous like support and the tangibility of the cards and knowing that people were there?
yeah, definitely the continuous support and even like messages and phone calls and things like that. Like everyone has been constantly reminding me that they're there. And I always say prayer works. We've
Hmm.
seen it. We've seen God move. We know prayer works because impossible things have happened.
Hmm.
So prayer all together.
Yeah.
Yeah.
Yeah. I'm so happy for you. I'm so happy that it seems like you're on the upswing of things, and I hope that your pots will be kind as you're
It
recovering.
it has been one of like the normal side effects for one of the chemos that I'm on can lower your heart rate. Not too
Oh,
much, like in a healthy way. So
yeah.
I'm actually like sitting in like the 80s for the first time in my life. And I'm like, this is nice.
Oh,
I can get used to this.
Oh.
And definitely with constant exercise, I'm marathon training right now. So I feel like that's
Wow.
new. That's definitely keeping a lot of things down. I still have my moments where I'm like, dang it, I forgot. I have to be careful when I set up. I have to
Yeah.
constantly stay hydrated and keep up on electrolytes. But
Yeah.
it's nice that like I can sit here and talk and not have to really worry until I stand up.
Right? That's great. Oh, that's awesome. Okay, so I wanted to ask you a few questions.
Absolutely.
All right, what do you think would be one helpful and one non-helpful thing for a Christian to say to someone with chronic illness?
One helpful thing is how can I serve you?
So asking.
I feel like yes, because it's different for person to person. I feel like some people love when you say, "Hey, I'm praying for you." But someone may feel like, well, what is prayer going to do? I need your physical support.
Yeah.
Like maybe that person needs a meal or they need a ride to an appointment or just a daily reminder, like, hey, like, I love you. You're important to me.
Hmm.
I feel like sometimes just hearing, I'm praying for you, I'm praying for you, I'm praying for you. Some people,
Hmm.
think, okay, but I need something I can see or, a physical, like hug, to
Hmm.
feel supported.
Hmm.
And one unhelpful thing, I feel like right now, a lot of Christians are invested more in politics and personal beliefs of medicine that it can kind of overcrowd minds when talking to someone going through a chronic illness or a health crisis. I would just say really be considerate of, especially if they're a Christian. Like we pray for wisdom of doctors, we pray for peace.
Hmm.
So to question our decisions based on only what you think is right,
Hmm.
you know, like that was an intimate discussion between me and God. I don't want to hear
Hmm.
anything else that is going to drag me away from that connection with God and how I feel peace on the subject. I am confident in God and the medicine He has provided for me. It's really
Hmm.
frustrating to be told, well, I don't think, chemo works because of XYZ in politics. It's like, well,
Hmm.
God put me on this path. Please let me follow God.
Yeah.
Um,
Yeah.
yeah,
Maybe kind of
that's the
just
number one thing.
unwarranted advice.
Yeah. Yeah.
Yeah.
But
Okay. So ask questions, ask how you can be there for someone with a chronic illness, and maybe hold back unwarranted advice.
yes, or even ask for under like ex I don't know how to phrase this. Like, ask how you can better understand their
Hmm.
connection with God and with peace through this so you can understand it yourself.
Hmm.
Like, I feel like that opens up a big conversation about God instead of just making assumptions based on personal beliefs. Yeah.
Yeah. Yeah, that's good. Okay, what are some of your favorite ways to relieve symptoms? I don't know if you had any, especially during like the heightened pain of your leukemia and treatment, but you have POTS and then possibly EDS. So, what are some of do you got any favorite ways to relieve symptoms?
Definitely talking to my friends and laughing. I feel like
Oh,
laughter is the best
laughter's
medicine.
medicine, yeah.
Yeah, during induction, I couldn't do anything. So just talking to people and laughing, that's how I got through it. Definitely now staying active and running when I can. There are some times after chemo where I just need to sit on the couch for a few days or I can't get out of bed. I still struggle with that. But
Yeah.
at least it's like 1 week out of the month instead of,
Yeah.
the whole entire month now. And
Mm.
definitely with marathon training, it gives me a goal to work towards and
Yeah.
I'm doing good.
Yeah. That's incredible. You're training for a marathon. Wow.
Never said I was good. I'm gonna get across that finish line. I might be the last person, but
Yeah.
everyone's like, that's crazy. I'm like, yeah, but you should see I'm probably running slower than you can walk.
Oh, hey, seriously, that's okay though. Like To be, yeah, that blows my mind. To be literally like finishing chemo and then training for a marathon at the same time is wild to me. That's crazy. That's crazy. Oh, how close are you coming to your goal?
I'm pretty much, I've hit my max distance for training.
Wow.
I follow this one training plan, but also the advice of my doctors, like up until, the longest distance I'll ever run, like I have to take it easy to prevent injury.
Yep.
So a lot of people are like, well, why aren't you, like training up to 20 miles? Like, why aren't you pushing it even though you still feel good after running? Because like I really got to prevent myself from getting injured.
Right. Yep. Good. Okay. I think my last question for you would be, well, what is, if you could say anything to anyone experiencing leukemia or a chronic illness, whether they're Christian or not, what is one word of encouragement or advice that you would give to them?
Don't be ashamed ever to reach out, ask your care team for something, or advocate for yourself if you are uncomfortable or in pain or could use support of any kind. For me, I'm not like the person to ask for things. If I'm inconvenienced, that's fine. I'm going to find a way myself to work around it. So I kind of had to break down that part, and I don't necessarily want, maybe pride is the right word. Maybe it's not. I don't know. But I had to really break that part down and learn how to ask for support. And it's never led me wrong.
Yeah.
Whether it's me, your care team, or even reaching out to, your church family to uplift you in prayer. I had elders come to my house before we drove to the hospital for me to be induced. Like, don't be afraid to reach out if you need anything.
Yeah. Solid advice. Stand up for yourself.
Yeah.
Yeah, that's what I'm working on every single day. Yeah.
It's worth it.
Oh, well, thank you so much for interviewing with me. Your story is incredible, and you're a very bright light and a very resilient person. And I have no doubt that Christ is shining through you. Not a single doubt. So keep sharing your story. Keep fighting for those with cancer and following what God is calling you to do. It's really beautiful.
No, thank you so much.
Yeah.
And for having this, outlet for us to be able to share the faith side, because I feel like there's not enough opportunities in the world to talk about God.
Yeah, absolutely. I'm glad to hear it. Well, thanks, Emily. I'll be praying for you and for your beautiful little family. And I'm very congrats on being technically in remission. And yeah, have fun on your marathon.
I will. I'm so excited.
Yeah, pace yourself.
I'll walk.
All right. Bye, Emily. Thanks so much.
Bye. Thank you.
Thank you so much for being a part of the Christians with Chronic Illnesses community. Please remember to follow, rate, and subscribe to the show. You can also follow us on our socials at CWCI Podcast. And if you're interested in sharing your story, please email us at cwcipodcast@gmail.com. If you are interested in contributing to the production of Christians with Chronic Illnesses, please see the show notes below for subscriptions starting as low as $1 a month, or email us for a more direct way to give. This show is hosted and produced by Ellie Sprague, and our incredible logo, thumbnail, and overall CWCI artist is Brianna Middleton. This show is intended for entertainment and encouragement purposes only. Please talk to your doctor before trying anything you hear on this show. Until next Monday. I present to you The Supernatural Case of an Accidental Time Traveler by my husband, Paul J. Trumba. It's a super interesting book. I'm not even much of a reader, but I read through this thing pretty easily. It's pretty large print, and it's about 500 pages. You can find it on Amazon. It's about Lou Barrett, who suddenly finds himself in London in the 1800s. He has no idea how he got there, and he goes on to form a really hilarious and cute relationship with a witch, a wizard, and a brawler, and they go on to fight supernatural evils together. I highly recommend. It's definitely for mature readers, but it's a really good book, and you can find it on Amazon. Again, that's The Supernatural Case of an Accidental Time Traveler by Paul J. Trumbull.